hand sanitizer. Well, thank you very much, everybody, for coming here this afternoon. I wanted to point out that you may have seen that I was able to use some hand sanitizer. Our hand sanitizer here is from our Department of Corrections. You may recall that I made the announcement, I think it was last week, that with the help of a company like Green Plains, which makes ethanol and converted to be able to make alcohol, they were able to work with our Department of Corrections to produce hand sanitizer, which we can now provide to other people, including what we've got here in the state of Nebraska, so in our Capitol building here. So thank you all very much again for joining us here today. We've got a couple of guests that I want to point out. John Albin, who's our Commissioner of Labor, who will be speaking a little bit later. Also, R.J. Vega, who is with Copal Mexican Restaurant on 48th and Pioneers here in Lincoln. They're going to be talking a little bit about what restaurants are doing to adapt. But I do have a few remarks I want to make, first of all, with regard to the coronavirus update. As always, I've been reminding people about social distancing. So we want to make sure people continue to practice that social distancing, that 6 feet distance from people, making sure that if you see somebody who's sick, you stay away from them, coughing into your elbow. Also, if you have a fever, coughing, shortness of breath, stay home, contact your healthcare professional, and especially in the areas where we have a directed health measure, make sure everybody in your household also stays home until you can go through the screening process with your healthcare professional and determine what steps to take next. So that's a very important thing to remind people to do. Also, continue to wash your hands regularly for 20 seconds. Make sure you don't touch your face with unwashed hands. This is how the virus spreads. Now, this past weekend was a really nice weekend. So it was great to see all the people out. It's one of the things my wife and I have commented on. In our neighborhood, we see a lot of people out walking with their families. That's all great out in parks. We want to remind people, even when you're outside, you still need to continue to practice that physical distancing. Try to stay that 6 feet distance, right? Avoid large groups. And when we say large groups, 10 people or more, okay? So again, this means that parents, don't allow a bunch of your kids' friends to come over if it's going to be more than 10. Don't play club sports, right? These are the things where you have large groups of kids gathering together. If you're going out to the park in general, again, folks, don't get into large groups of more than 10 people. Keep that social distancing. I know it was a great weekend, great weather this weekend. We still need people to keep that social distancing. The name of the game is slowing the spread of the virus. The way we do that is by avoiding large public groups. So please keep your distance. Also, when you go to the stores, we want to make sure you continue to keep your distancing there as well. That 6 feet distance from other customers in that store, whether it's your grocery store or one of those big box stores. I know, for example, Costco, which actually had some lessons learned from their Costco in China, has been doing a great job of keeping customers 6 feet out, putting tape on the ground, wiping off the conveyor belt as between customers before the food goes up to the checkout counter. All those sort of things are important. So please, folks, when you go out, only go out when you need to, and when you go to those stores, make sure you keep that social distancing in place between everybody. So that's an important thing to remind everybody as we continue to work on controlling the spread of this virus. It's also that time of year now when people are going to be coming back from maybe what they've been spending the winter. So if you have a winter home down in Arizona or in Florida and you're coming back to the state of Nebraska, or maybe you live someplace else and you're coming back to Nebraska for a cabin you have here on one of our beautiful lakes, or maybe you're coming back for Easter here in a couple of weeks. I want to remind everybody, when you're coming back from those places around the country that have community spread, when you come back to Nebraska, you need to quarantine yourself for 14 days, okay? So if you are coming from out of state someplace and you've got community spread where you're coming from, those places like in Arizona and Florida, you got to quarantine yourself for 14 days. Now, this does not apply to transportation workers. If you're a truck driver, if you're in the railroad industry, if you're a contract worker who regularly travels for your job, that's not what I'm talking about. I'm talking about people who are, say, snowbirds that go away for the winter and are coming back as the weather's starting to warm up here. Quarantine yourself for 14 days. And especially if you're coming from back from international, which I know there's a few people doing that now, but again, everybody coming back needs to quarantine themselves for those 14 days. Yesterday, President Trump made the announcement that his 10-day rule is being extended. And I want to, first of all, thank President Trump. I think that when he made that announcement 2 weeks ago with regard to the 10-person rule, no public gatherings larger than 10 people, that he really kickstarted the country into awareness about what we need to do to slow the spread of the virus here in our state. So I think President Trump showed great leadership in kicking that off, and he has asked that we extend that now to April 30th. That's a great move too. So here in the state of Nebraska, we will continue to extend that 10-person rule to large public gatherings statewide. Okay, so everywhere across the state, the current rules we've been working under for the last 2 weeks will now apply till April 30th. Now, if you are in a county where we have already issued a directed health measure, the directed health measure will take precedence. So for example, we now have 18 counties that we've issued a directed health measure for. So if you're in one of those counties, like whether it's, Douglas, Sarpy, Lancaster, wherever, you will now be under that directed health measure until that date expires. So for example, in Douglas County, it is April 30th. But in some of our other counties, now it's May 6th. And so that will take precedent. That May 6th directed health measure will take precedence over this statewide rule around April 30th. So I probably have confused everybody out there. I'm sorry, but again, check with your local public health department. If you're under a directed health measure, then you need to follow that to whatever we've issued in whatever part of the state. We've got 18 counties. If you're not on a directed health measure, we're keeping the 10-person rule till April 30th. Earlier today, I signed our disaster declaration request to be able to submit that to the Federal Emergency Management Agency and ultimately to the President. The President has signed a number of these disaster requests for other states. I expect that they're going to turn that around very quickly. You may recall 2 years ago, or last year rather, seems like 2 years ago now. Last year though, when we had the flooding, FEMA and the President quickly turned around our disaster request in about 2 days' time. I would expect to get this back very quickly as well. And what that will do is allow us to tap into both individual assistance, which is designed for, obviously, individuals, and public assistance, which is designed for our counties, other things like that, public institutions. So the individual assistance, for example, allow us to get disaster unemployment, disaster management, disaster crisis counseling, disaster legal services, that sort of thing. With regard to the public assistance, that will allow us to be able to tap into things like hazard mitigation or be able to do debris disposal. In this case, the debris may be medical materials, so allow us to get help with that. So that is one of the things that we've requested from the federal government, and we expect to get that response back pretty quickly, and that will help us, again, meet the needs of this coronavirus and fighting it. We also have put out new guidance today with regard to homeless shelters. You can find that on www.dhhs.ne.gov/coronavirus. So again, for homeless shelters seeking guidance out there with regard to how they handle the folks they're taking care of, I've directed there to be able to go take a look at what our new guidance for that is. So those are some of the big highlights of some of the things that we have to update you on today. At this point, I'd like to bring Commissioner Albin up to talk about the CARES Act. So again, I want to first of all thank our federal delegation for working with President Trump to get the CARES Act signed so quickly. This really was turned around in record time to be able to provide additional assistance to the people of our country, to be able to help them recover and fight this coronavirus outbreak. Again, just working very fast. Now, again, it got all put together very quickly, which means that this bill, which is almost 900 pages, is something we are still unpacking to understand how it will impact us across the state. But there are 6 new unemployment benefits that are part of this CARES Act, and Commissioner Albin is going to explain a little bit about what people should expect, what they should be thinking about, what they'll be eligible for, that sort of thing. So with that, Commissioner Albin, I'm going to ask you to come up and talk a little bit about that.
Thank you, Governor Ricketts. Good afternoon, all. Just kind of a little bit by way of background on all of this. On last Friday, the governor authorized me to enter into agreements with USDOL for the 6 programs that are contained in the CARES Act. USDOL sent us the agreements for 5 of them, and we have executed and returned them on Saturday, all 5 of those programs, and I'll let you know which one we're still waiting for the agreements on from USDOL. It is the STC program, the short-time compensation. They have not got the guidance out to us on it. I expect to see it this week. I've got to hand it to our partners at the federal level. I was receiving and responding to emails both Saturday and Sunday from individuals in our regional office trying to get this thing up and running as quickly as possible. By virtue of the fact that we got it back to the USDOL on Saturday, that means technically it's in effect this week. But you got to remember, it's like the regular unemployment system. We always pay a week in arrears. So even though technically someone could qualify for the various benefits this week, they can't even certify their eligibility for it until next week. So they will not get a check this week. I'm hoping for next week, but we'll see on that. You got to understand the complexity of it when we basically we waited and we had to wait until the House acted to know for sure what our programmers were working on. They had 45 programmers at our vendor working on it over the weekend to try and get things up and running. At least a couple of the programs, the 2 main ones, are already in test. Now, for those of you who are familiar with IT, the first test never works, so there will be a couple iterations before we're done, but we're hoping. We originally had thought 2 to 4 weeks. I'm hoping it's before we could pay. I'm hoping it's closer to that 2. Just a little bit about the process that everyone should follow. If you think you're going to be eligible under one of these programs I'm going to describe, go ahead and file this week. You might remember 2 weeks ago we had added the COVID-19 question to our initial intake. And so if you indicate COVID-19 on your claim, we will automatically either get you enrolled in the new program or we will contact you back so that we can get you back started into the new program. Because some of the questions that are applicable to some of the new programs aren't in our existing software, but they will be in the new one. So in those cases where we didn't get that question because you weren't eligible now, we'll get back with you and do it. You don't have to do anything, just get your claim in, because it starts with this week, and in fact, in one of the programs, it's retroactive to January 27th, which means we're really going to have to talk to you a little bit to get those established. As the governor said, there's basically 6 programs. Probably 2 or 3 of them probably don't mean a lot to the average claimant. They will mean a lot to the state's trust fund account. So I'll go through them, just kind of take them in order as they're laid out in the bill. The first one is in Section 2102, the Pandemic Unemployment Assistance Program. PUA is the acronym. I'm not sure I like the acronym, but it's the acronym that it goes by. This is the one that you've been getting the most questions about because a lot of people, the hairdressers, the barbers, and those that are shut down, the self-employed, that aren't a part of the traditional unemployment system, that is the program that they will receive benefits under. There aren't a lot of qualifications, but the big one and the most important one is the inability of the worker to work must be related to COVID-19. If your business just went bad and you stopped doing business, that you're not eligible under the PUA assistance. If, on the other hand, your business closed because you're a barber and they closed your shop until, I think mine's closed till April 20th, you would be eligible under this particular program. And I know it's going to seem a little bit convoluted to people when they go into the system, but bear with us. It's the way the rules are, so we got to play that way. And that is, you will file a claim, and if you're filing this week, it will tell you you aren't eligible for benefits. You don't have enough monetary wages earned during your base period. Don't panic at that. We're working to see if we can get a question on the other end of it. That's a prerequisite to being eligible under the Pandemic Unemployment Assistance Program. We have to tell you you're not eligible for unemployment, regular unemployment, before you can be eligible under the pandemic plan. So I know a lot of people will be confused by that. It seems confusing to people. The program will be administered the same way the disaster unemployment insurance has been in the past. I don't know if you remember last year when there was the flooding, there was the DUA program back then for the self-employed who lost their ability to earn an income. They had to go in the same way. They file, we tell them they're denied, And then in that case, we had a program that was already in place to do it. In the case of PUA, we're still building it, so there'll be a little bit of catch up on our part once you get into it. But when the new software comes out, you will be able to receive, it'll just take you into the automatic system. Basically, the rules has to be COVID related. You can't be eligible for any sort of unemployment of any of the programs, whether you're talking about regular benefits, extended benefits, et cetera. About the only people who can't get it are people who are able to telework for pay, and individuals receiving paid sick leave or other sorts of amounts. The benefits will range from $174 per week at the minimum to a maximum of $400. And you've all heard about the $600 a week. I'll talk about that shortly. That $600 a week will also apply to the Pandemic Unemployment Assistance Program. The second program, that's more a little bit of an insider for us, but it will help the trust fund. Under this one, right now, the states and the school district, or the state out of the trust fund is paying the entire amount of benefits for nonprofits and governmental workers, and this would reimburse us for 50% of that amount, so that will help sustain the trust fund. The $600 one, Federal Pandemic Unemployment Compensation, often referred to as FPUC, is the $600 payment. And how the $600 payment works, as we understand it right now, is that you will file your regular benefit or your pandemic unemployment assistance claim. We will determine your eligibility under that claim, and then there will add another $600. You don't need to make a second application. You don't have to do anything else. It'll just automatically go, and then it'll be paid either through your debit card if you chose that, or direct deposited to your checking account if that is the alternative you chose.
So long story short on that one, John, they don't need to do anything.
They don't need to do anything. The fourth program, real shortly, as you know, under the executive order, we waived the normal waiting week requirement. USDOL has agreed to fund that waiting week requirement going forward. Then there is, and I love their acronym, there's a Pandemic Emergency Unemployment Compensation Program. That basically pays an extra 13 weeks of benefits to any individual. Normally you're qualified for 26 weeks. It will extend it out to 39, and that will also, provision will also, same 39-week period will be applicable to the pandemic claims. And then finally, the one we're still waiting on some guidance from the feds on, but the federal government will pick up half of the cost, 100% of the cost of short-time compensation programs, benefits paid under that program by the states. So it'll take some time to get our IT systems up. We're adding adjudicators, we're adding IT. Like I said, our vendor was there for had 45 people on it this week. And with that, I'm going to close and turn it back over to the governor. Thank you, Governor.
Great, thank you very much, John. And appreciate you bringing us up to speed on those 6 new programs. And I know this is all confusing, can be confusing, just given the complexity of what's going on in the unemployment system in general and the fact you're dealing with the federal government. But we appreciate the work that you and your team are doing to make this easy as possible for Nebraskans. So thank you very much. And then, as I mentioned, the CARES Act is a big, complicated bill with nearly 900 pages. We are still analyzing it, but we will bring you up to date on other aspects of that bill as we figure this all out, work with our federal partners on how it's going to be implemented. So we'll continue to bring you updates with regard to how that CARES Act will be executed here in the state of Nebraska. Next, what I'd like to do is talk about one of the industries that has been greatly impacted by the 10-person limit rule, and especially in places where we have a DHM, where restaurants cannot have dine-in, neither can bars. They can do takeout, delivery, or drive-through only. So one of the things I'm requesting is that Nebraskans think about Takeout Tuesday. Hashtag Takeout Tuesday is how you can find it. Here in the governor's office, we've brought in chicken from Lee's Fried Chicken. I got a burger today from Honest Abe's. We've been to Graywell Poke to pick up stuff and bring it here. Support your local restaurants. Everybody in the restaurant industry is having a tough time right now, And your ability to go out there and support these local restaurants means all the difference in the world to the folks who own those restaurants and the people who work at these restaurants. One of the things you can do, for example, is you can buy gift cards, and that would be a great way to help out these restaurants. So, as part of our effort to be able to continue to promote industries that have been impacted, I have got a proclamation here proclaiming the next 4 Tuesdays in the month of April here, Takeout Tuesday, and with my signature, we are officially proclaimed Takeout Tuesday starting tomorrow and continuing through the rest of the month of April. Now, to be able to help talk about what the restaurant industry is doing to adapt to these very trying circumstances, I've got RJ Vega with Copal Mexican restaurant here in town. And again, I mentioned they're on 48th and Pioneers. RJ, would you like to come up? And first of all, I'm just going to leave this here for you. So this is yours to take. So we're doing that good social distancing thing. But why don't you come up and talk to us a little bit about what your restaurant is doing to adapt to these trying times?
Good afternoon, everybody. Thank you, Governor, and the team around you for the opportunity to share a few remarks from the perspective of a local restaurant, small business, and the perspective of those of us who do make a living as a server, bartender, hourly, and kitchen staff. My name is RJ Vega, and today I represent Copal Progressive Mexican Cuisine, and you can find Copal at 48th and Pioneers here in Lincoln. And recently it seems like each new day has brought forth a new set of challenges, not only to make payroll or keep the lights on, but as business owners, as those of us who are servers and bartenders and hourly staff, these changes have affected our way of living. In our case at Copal, thanks to the leadership of our general manager, Rebecca Lopez,
Rebecca's here in the audience with us.
She's here with us. We, the staff at Copal, we made it clear from the beginning of all this that we would be honest with one another and we would be authentic with our community. We immediately formulated a strategy to increase our social media content, which came in handy as society began to stay home. Rebecca designed some quality images that we could then post online, such as our white glove takeout menu and our daily specials. We implemented a delivery service, which is something we previously had not done personally as a restaurant. We even invested time and staff into creating a few quick videos that we could then post online, and that way we could speak directly to our community, which I think they value that. Yes, it's been a learning curve. Mistakes have been made, and we thank all our guests for being patient with us and supportive with us as we adapt to the changes. And we do thank our elected officials and the public health officials for keeping us safe and updated and informed with all the recent changes. The sealed margaritas to go has been a big welcome for us as a restaurant, so we appreciate that. But here's the point. Is at the end of the day, we're all in this together. Todos estamos en esta juntos. Okay, we're all in this together in Spanish. We're either facing, or we know friends or family that are facing, a reduction of hours and a reduction of income. But now's not the time to despair. Now's the time to come together as a business community, as a Lincoln and a Nebraska community, as an American and a global community. And let us invest in one another, let us support one another, and participate in efforts like Takeout Tuesday, which will benefit all our smaller and local restaurants and bars and businesses. So we'll get through this together. Juntos, mi gente, lo haremos. Thank you very much for your time.
Great, thank you. RJ, don't forget to take the proclamation with you.
Yes, thank you.
Great, thank you very much, RJ. Appreciate you coming in and representing all the restaurants that are really going through a very challenging time right now and what you're doing to adapt. And of course, with regard to the margaritas to go, the sealed margaritas to go, first of all, just remind everybody you cannot open those and drink those in the car. Okay, that's still illegal, but you can take it with you. I think that has probably been the most popular thing I have ever done as governor. So thanks for your work on that. A couple other things that I want to round out with. President Trump talked about today being National Doctors Day, and I want to thank all the doctors and other healthcare professionals for all they have been doing here in the state of Nebraska, not only to take care of the population in general, specifically around the people impacted by coronavirus, but also the great adaptations they are making to be able to make sure they keep Nebraskans healthy and safe. So thank you to all of our healthcare workers and all the work they're going to be doing over the course of the next several months to make sure that we keep Nebraskans healthy and safe. I want to draw attention, there's been a post out there on social media that apparently this is an early April Fool's Day joke, that somehow I have been out there communicating that every child will have to repeat their grade next fall. That's not true. We've actually been up here with Commissioner Bloomstead saying the whole goal is to make sure every child advances to the next grade for next fall. But if you see that out there, please don't share that with anybody. It's not coming from a trusted news source. It's absolutely not true. The whole goal of all of our schools is to make sure our children are continuing to get their education right now, even if they can't return back for the school, to the school during this school year, and get them advanced to the next grade in the coming fall. Last week, we had our television town hall on NET on Thursday night. We will be doing another one of those television town halls. We were going back to the regularly scheduled time for Speaking of Nebraska, which is 8:30 to 9:30 p.m. But again, that will happen Thursday night, NET, 8:30 to 9:30 p.m. And finally, before I get into the questions, I just want to let everybody know that it has been a trying month through the month of March, and April is likely to be another tough month. As I mentioned last week, as we have our testing capability expand, we should see more folks test positive. Last week, we also experienced the first 2 deaths related to coronavirus here in our state. We can expect April's going to be a tough month, folks. Depending on the models you're looking at, we could see the peak of that here in our state in mid to late April. And so we've got a lot of work getting ready to be prepared for that. It's going to be a tough month. That's why we need, again, every Nebraskan to be participating in our social distancing guidelines. No large groups over 10 people. Make sure you're washing your hands. Stay home when you're sick. These are the sort of things that will help us slow the spread of virus here in our state and make sure we do not overwhelm our healthcare system, and make sure that everybody who needs that hospital care will be able to get it. So this is the way we're going to keep Nebraskans, especially our most vulnerable Nebraskans, folks who are older and with an underlying health condition. This is how we're going to keep them healthy and safe. So it's going to be a tough month coming up here, but as RJ said, we're all in this together. We're all going to work together, and that's how we're going to get through this, as Nebraskans together. So with that, I'm going to go ahead and, as we, again, trying to practice good social distancing, we have our reporters who are not present with us, and they email in questions, and so I'll get to those questions first. First, from Paul Hamill of the Omaha World-Herald. He said, got a question from a reader who has owned a painting company for 33 years and is scared to death that he will lose it all. Why, and this is apparently from the painter, why can't I be allowed to have my painting crews work in an empty school and other businesses? I'll put people to work, he says, even work all night if we have to, with crews of 3 to 5. He said OPS won't let him in a school to paint, to finish a job they've already started. Wouldn't it make more sense than somebody going on unemployment? And first of all, I don't have the name of the painter here, but I did talk to Dr. Cheryl Logan at OPS. She says, hey, reach out, contact me directly, give me a call, contact my office, send me an email, and they'll work it out directly with the painter. But broad brush strokes, pardon the pun, is that she is trying to keep her schools sanitary, and so anytime she lets somebody into a school, they have to scrub it all down again. So while all the construction is done on the outside of the school and all the new construction is going forward, the stuff that's on the inside of the schools has been temporarily halted, but she will work with vendors on that as well going forward. But again, that's the reason why if you're doing jobs inside the schools, you can't do them. So again, reach out to OPS and they'll be able to fill you in on the details of how that will work going forward. This is from Charlie Brogan at KFOR. Has any discussion been had on whether the cancellations and postponements will affect any criminal trials and whether we will be in danger of speedy trial rule dismissals? If so, any discussion of an executive order or need for legislature action to avoid it? Here again, folks, this is one of the areas where Nebraska has been a leader in the nation. Our Chief Justice, Heavican, actually was either last year, I believe it was last year, put together a pandemic bench book, which is a guide for how you operate the courts during a pandemic. He seems to have been very foresighted and prescient in this by getting this prepared ahead of time. And my understanding is this bench book is being used in other parts of the country as well as a guide for how you operate the courts during a pandemic. So again, Nebraska is a leader in how you run courts during a pandemic. I don't expect that we're going to see any of these issues that Charlie is describing here with regard to speedy trial rule or dismissals or the need for an executive order or legislation. Certainly, we have been staying in touch with the judicial branch on this, and if we need to do something like that, we will. But I think that, again, Chief Heavican has really gotten out in front of this early to be able to help his courts stay in business and continue to administer justice even during a pandemic. This from Henry Cordes of the Omaha World Herald. It seems to me that the $600, and I assume this is referring back to the CARES Act and some of the programs that Commissioner Albin was just describing, it seems to me that the $600 does create some problems. If, for example, it was, if I was one of 2 cooks at a restaurant and I got laid off while others were still working on carryout, I would come out way ahead, while he would make the same thing he was making before. Also, not sure how it would impact trying to bring workers back. At the same time, it does protect people better than the regular system. It would be nice if people were made more whole during the short-term period, and I suppose it is a stimulus to put money in people's hands, the same reason we are doing the $1,200 per person thing. So I don't think Henry meant that second one to answer his own question, but just getting into it, obviously, this is an emergency. The $1,200 the government is distributing is part of that emergency aid. This additional $600 per week is a part of that emergency. And while it has been extended by one of the other acts, right, to be 39 weeks, again, it's meant to be a temporary measure to be able to help folks out during a time of emergency. I suspect that if you have a job for that long-term perspective, you'll want to keep that job and not make a short-term decision about trying to go on unemployment. And remember, if you quit, you will not be eligible for that. So a couple of years ago, the legislature passed LB 203. So you can't quit your job and collect unemployment. That still applies. You have to be laid off specifically because of a coronavirus, or you're sick and you have to stay home, or you have to take care of a child and you have to take home. You have to be impacted by coronavirus to be able to take advantage of these things. And so I really, this is actually one of the reasons why I think Senator Sass was trying to get some changes made to that bill on the floor of the Senate, because he viewed that as being a disincentive for work. So I think that it does have that potential, as Henry's describing here, but I think also here in the state of Nebraska, we do have some of the safety measures in place that if you were laid off for this, you'll be able to collect. But if your employer calls you back to work and you don't go, that's considered a quit, and then you'll not be eligible for those benefits anymore. So again, I think we do have some of the checks and balances in place with regard to this particular system, that it really shouldn't become a problem here. Again, it's meant to be a short-term emergency measure. I think that's the way it'll be implemented and seen here in the state of Nebraska. So I really don't expect this to be a big problem. Then, from Chris Burback, Omaha World Herald. Would the governor like to comment on the state of FOP's letter to the governor that requests notification if they are being dispatched to a home where someone is known to have a coronavirus? So I think that in general, with regard to law enforcement, this is something that they should be thinking about when they're being dispatched to somebody's home. Just like we were talking about with some of our businesses who are asking their customers if they've got a fever, if they've got a cough. Law enforcement should be doing the same thing with regard to that. Obviously, one of the things we want to do is to be able to expand our testing so that we can prioritize law enforcement as a part of that. But certainly, FOP should be making, or not FOP, but the law enforcement should making the effort when they're being dispatched to somebody's home or dealing with somebody. The first questions probably ought to be, have you had a fever? Are you coughing? Have you been exposed to anybody who's sick? Just like a lot of the businesses who are bringing in customers are doing the same sort of thing. So I think that's good prudence, would be good prudence on the part of law enforcement. So that, I believe, brings the end of the questions that were submitted ahead of time. Taylor, do you have any others that were texted in?
We have a few more. Don Walton has 2 questions. The first one is, modeling published in the Washington Post today suggests 424 coronavirus deaths in Nebraska by early August. Does that match what we may have heard from UNOC?
So the question was with regard to modeling in the Washington Post, and this is from Don Walton of the Lincoln Journal-Star. There was modeling published in the Washington Post that showed that the deaths in Nebraska would be 424. And does that, how does that measure up with what we've been told by UNMC? We are actually still working through our models with regard to what we think the peak will be here in Nebraska, so we don't have anything to compare it to specifically with regard to that. But obviously, all of our efforts are around making sure that we reduce the impact to people here in Nebraska, that we spread this out so that anybody who does need that hospital care will be able to get that and have the best available care to be able to survive and let their body fight off the coronavirus. So that's our whole goal, but I can't specifically get back to you because we still are working on our own modeling.
He also asked, have Nebraska hospitals been able to acquire sufficient ventilators and protective gear, or is that still an ongoing process?
So Don Walton also asked, have Nebraska hospitals been able to acquire enough ventilators and protective gear, or is that still an ongoing process? One of the things we are doing with the state public health department as well as our local public health departments is we are working with our hospitals to be able to get an inventory of hospital beds, ventilators, all that sort of thing, to be able to get a good idea of what we think our peak needs will be, to be able to accommodate those. We're also working at the state to buy PPE that we will distribute out to people who are running short. We have told all the folks out there, whether you're a hospital or an emergency service provider or a law enforcement official, go out and try to acquire it on your own. But we at the state are working to acquire this. We've got purchase orders in. We're expecting some deliveries hopefully this week with regard to this. We're going to continue to work to acquire PPE to be able to distribute it out. Again, we've been relatively lightly affected here in Nebraska. The President's order got us a kickstart on slowing down the spread here. So we have not seen hospitals impacted directly. And so, you know, we've got the next couple of weeks to really get that all prepared and be ready when we start seeing more cases going into the hospital. And again, greater need for PPE and greater need for ventilators. So we're working on all those processes right now.
So all the questions I have now.
All right, great. Questions from the media that's here in the room with us?
Commissioner Alden?
Yes, Fred.
Did I understand you to say that self-employed people under the federal program will be eligible for between, was it 147 and 174 and $400 a week?
For those listening, the question from Fred Knapp is what are the amounts of assistance the self-employed will be able to receive under the Pandemic Unemployment Assistance Program. It'll range from $174 to $440. It'll be based upon the income that you've earned. And then through the period of the $600 additional payment, they will also be eligible for that $600 additional payment.
Oh, okay. And what's that period?
The period on the pandemic assistance is through July 31st of 2020.
Okay, and then for people eligible under the traditional program, did I understand correctly, it's their usual amount, which is half of their regular salary up to $440 plus $600?
Yes, the question again from Fred Knapp was, how are the benefits computed for the regular unemployed? It's the same under both programs. It's based upon half of your average earnings, and then it's capped out at the $440. Plus the $600 under the additional payment, yes.
Another question on eligibility. If you say are working this someone work 40 hours a week and you maybe those hours cut in half, are those people eligible under this new program?
It will depend. The question was, if somebody's hours are just cut in half, will they receive the unemployment benefit under the new program? You have to be ineligible for the regular program. So if you're ineligible for the regular program, then you would get paid. What we expect on the half hours, and we're encouraging employers strongly to do, is to implement a short-time compensation program, because you're clearly eligible under that program to receive both the half your regular unemployment benefit plus the hours that you're working. So we've been encouraging people to use that short-time compensation program. But the big thing is they need to file.
Also, July 31st for the added benefits within pandemic emergency unemployment compensation pay extended from 26 to 39
Yeah, the question is the difference in dates because the PUA, or the, excuse me, I gotta get my acronyms right or I'll get, the PEU, or excuse me, FPUC program, goodness. That's the one that pays the $600, and that one's in effect through July 31st. I think Senator Schumer referred to that as his 4 months of full pay or something like that. The PUA program, the standard benefit, the equivalent of DUA and regular benefits, the PUA is automatically 39 weeks, and then by virtue of the legislation, regular benefits are also extended additional 13, so 26 plus 13. They're both 39-week programs during this act, and those both expire on December 31st.
So, I'm still confused. What happens July 31st? People's benefits go down, but they keep on going longer than the other ones?
Yes, if you were receiving $440 a week plus your $600, $440 under the regular program or the PUA program, and you're getting the $600, and then the July 31st comes and goes, instead of receiving $440 plus $600, you receive $440.
But you will get to receive it for an additional 13 weeks.
Yes, you'll get the full 39 weeks.
Yeah, Martha.
There have been some entities that have looked at cell phone data to track how well people are doing with social distancing in different parts of the country, and Nebraska did not come out very well on those.
I thought we got a B. I mean, it's not an A, but I thought that the one I saw, we got a B on that one. Sorry, the question was about tracking cell phone data to see how well people are doing on social distancing. And the report I saw had us get a B, but it was also looking at people traveling. So it may have been a different report than what you were talking about.
Yeah, I've seen a D.
So again, I think that it's subjective. Like I said, I saw us getting a B, which we'd like to get an A, which means that people are doing a good job of social distancing. But I do think, and we have talked about seeing if we can use that cell phone data and somehow work maybe with the University of Nebraska and some of their facilities and people to be able to actually get a better sense of how people are doing that social distancing. So I don't have anything to tell you about right now because this was just an idea we started discussing last week about how we might implement something like that. But it's kind of a cool idea of how we could know whether or not people are actually doing what they need to do with regard to social distancing. But again, this is why every one of these press conferences start off with me reinforcing what we need to do around social distancing, including some of the observations that I had this past weekend and other people shared with me about being outside and being in large groups or going to the grocery store and all that sort of thing. We really need Nebraskans, especially this month. As I said, it's going to be a tough month. We need people to really take seriously the social distancing, keeping that 6-foot distance when you're at the grocery store, when you're at the park. Make sure you're doing that because this is how we're going to slow the spread of the virus and make sure we have the hospital capacity to handle people who will need it. Yeah, Martha.
Governor, have we started to see the results of some of the expanded testing, the drive-through testing at Bryan, for example, and we now have some additional testing capability? Has that started showing up in results yet?
So a question from Arthur Stoddard again from the Omaha World Herald, sorry I didn't do that the first time, was about have we seen some of the testing results starting to come up with regard to our increased capacity, other organizations like CHI and Bryan and so forth. And actually, tell you what, Dr. Antone, if I could ask you to come up and just say a few words about what we're doing with regard to the expanded testing and just give us kind of an update.
To address the drive-up or drive-through testing for Bryan Hospital here in Lincoln, it's going fairly well. I was just informed this morning that they have received back about 46 results of their tests that they started last Tuesday and have received 3 positives. So fairly what we've seen as far as our testing goes. So far in Nebraska, we have done over 2,500 tests, and every day it goes up quite a bit. So that yesterday was our number 1 day for the number of tests, over around 290 tests were performed. So we're seeing expanded.
Was that just the public health lab?
That was through all the labs,
All the labs.
including the commercial labs too. So our testing rate so far is still right around a 5% positive rate. So that means of all the tests we do, about 5% turn positive or have been positive. And that's been a very steady percentage over the last several weeks, 2 to 3 weeks. As we expand testing, we're going to get more positives. So we're going to probably see that percentage go down, even though the number of positives will go up, but the percentage will go down. So there's all sorts of talk now about these rapid tests. We've just received word that this might be something we'll be doing or getting shortly, but we'll have to wait to see how that goes. But even with that said, our expansion for our public health lab up to close to 400 a day now. With the other labs, University of Nebraska has a capacity of around 280 per day now. CHI around the same, around 250 a day. And then the commercial labs are unlimited, basically. Whatever they send out is what we're doing. And we're receiving back about 200 results from the commercial labs per day now. So as far as testing goes, I think we're doing well. We had quite a few people tested this weekend, as you know, and we're awaiting those results back right now.
So it sounds to me like we're just at the beginning of getting some of the results from this expansion. So the increases that we've seen are not from that expanded testing.
Well, the question was, are we seeing any difference in the results from the expanded testing? And so far, the criteria that we're using for testing have still remained the same, although what we're really expanding in now is healthcare workers. We're making sure that healthcare workers, first responders, and long-term care facility residents are getting the priorities for their tests right now.
We have a question from Bill Shammer at 1011, which Dr. Antonio, the governor, could take. He says, in Nebraska, we've been limited to one support person during delivery. Should expectant mothers be fearful of their right to a support person throughout labor and delivery being restricted to 0 support persons in Nebraska?
I do not know. Well, the question was about support people during deliveries.
Is that like a husband?
Yeah.
A wife?
Yeah.
Or something like that? I mean,
That is a question I can't answer right now. I'll have to look into that.
This is along the lines of the priority for healthcare workers and the people on the front line. We've seen obviously in hotspots around the country, the doctors with exhausted hours, that kind of thing. Have we seen any care facilities in town where you know of that doctors or nurses and or anyone involved have been on longer shifts or extended periods of time without those kind of breaks?
So the question is about healthcare workers, specifically frontline healthcare workers like the doctors, the nurses, PAs, nurse practitioner. Are we seeing any fatigue issues, I guess I would say? And so far, no. As a matter of fact, even at this time, just this morning, we only have a total of around 20 people in all the hospitals in Nebraska right now that have been being treated for COVID positive. So, and I think this has a lot to do also that they're not so fatigued right now. I'm not saying they can't be in the future, is because of the cancellation of elective surgeries has really decreased the amount of work that they're doing in their hospitals now. Most hospitals that I've talked to are running at around a 50% or so census rate, which means 50% of the hospital beds right now are not occupied.
Doctor, I've heard that you talk about there's only 20 people in hospitals that have tested positive for COVID-19, but there are a number of people in hospitals who are rule-out cases where they have to be treated as if they have that, and so that puts a lot of pressure on the hospitals and the staff.
So the question is even though we only have around 20 people in the state of Nebraska being COVID positive being in the hospital, we have, according to my check with a lot of the CMOs of the major hospitals, a daily census of around 10 to 20 people per day that are presumed or being tested for COVID and then being ruled out and either being treated and sent home or obviously, depending on their test results, being staying in the hospital. So you're right, there is still a number of cases that have come into the hospital to get treated and then ruled out or ruled in for whether their test is positive.
Is that 10 to 20 statewide?
No, it's just in the major hospitals that I've been keeping in contact with.
But per hospital?
No, just the 2 or 3 major hospital systems in the Omaha area right now.
That's total for all of those 3 hospital systems, is that accurate?
No, it's about 10 to 20 per major
Per
hospital
one?
system, yes.
You mind if I ask, was it RJ? Sorry, could I ask you just a few questions about how these kind of things have directly helped? You kind of mentioned that you talked about the pickup margaritas and the side, the curbside pickup. I mean, you know the business owners in town. Like that impact has to be monumental for your kind of business. Can you kind of just give maybe a little explanation, I guess, on that topic?
Sure, yeah. The question was in regards to explaining, I guess, what that feels like, what we're seeing out there in restaurants and small businesses. You know, we at Copal feel very, very gracious that we have a lot of supporters in the community who, as soon as things started to pick up speed around everything that's going on, they reached out to us and they said, you know, hey, we want to help you, we want to support local, so we can't say thank you enough for that. A lot of just positivity from the community, you know, restaurants and other small businesses too, not exclusive to us. So the changes and efforts to adapt things like the sealed margaritas to go was yeah, a very positive thing for us and our business model. So, you know, we can't thank you enough for helping us in this time, so.
Governor, I have a question for you. You brought in some of the hand sanitizer that the Department of Corrections is making. When can people expect that to be on shelves?
So what we're doing with regard to the Department of Corrections is we're using it for our own purposes as well, like right here in the Capitol or in Department of Corrections. And then we're going to be distributing this as part of our allocations to Public Health Department. So we're not going to be selling this in stores. What this is going to be really taking the place of is the state having to go out and acquire this in the marketplace for distribution to our public health partners.
We have a question from Paul Hamill. It's a reader question. Are restrictions on critical access hospitals in rural areas being considered? They can only have 25 patients and a patient can only stay for 96 hours.
So the question was restrictions on critical access hospitals with regard to the length of stay and how many patients they can have. And I'm actually going to look at Dr. Antone to see if he has an answer. If he has an answer, I'm going to call him up. If not, I'm going to say we're going to have to look into that and get back to.
We're going to have an answer by 1 hour.
All right, so to Paul Hamill, the Omaha World Herald, who asked that question, Dr. Antone said he'll get back to you within the hour to be able to give you an answer with regard to what's going on with regard to those specific restrictions. So thanks for the question, though.
We got one particular question from a viewer asking, obviously each state is making their own particular plan, but how much have you been in contact with local governors, Ken Reynolds was named specifically, about kind of specific plans and working together?
So actually, the question was with regard to how often do I have contact with other governors with regard to what's going on. We actually have a lot of calls every week, frankly. I mean, we've got the Call the President sponsors with all the nation's governors. That occurs a couple times a week, and so we were on that earlier today. I've got a call at night a couple times a week with some governors. I've also got the NGA also set us up a big 50 governor call, so I've got kind of a smaller group that we work with twice a week. We've got the big governor group separate from what the president does with the National Governors Association, and then there's always a number of calls that go on during the week to be able to talk to governors about different issues. So I've spoken with Governor Kim Reynolds from Iowa. I've spoken with Governor Kevin Stitt from Oklahoma. I've spoken with Mike Dunleavy from Alaska in just one-on-one conversations where we've been talking about different issues. So I think actually one of the things you see from governors is that we are communicating quite regularly with each other to be able to share ideas and talk about how we address different things and learn from everybody. So I think there's been a lot of great communication with the governors all across the nation. Yeah.
This is in reference to the Omaha mayor, voicing her displeasure about people going to the pop-up stores over the weekend. I know you said not going to go to any stay-at-home orders. Is there anything stricter that could be taken besides a directive health measure, or is it basically at that point we just say the local
So the question was, the mayor of Omaha made some comments with regard to people going to some of the big box stores and making them crowded and asking them to really only go shopping when you need to and keep your social distancing. And our plans to do something more restrictive with regard to the DHMs, the directed health measures. We have got a plan that we put in place weeks ago, working with UNMC. We are at the most restrictive DHM we have right now in those 18 counties that we've issued these directed health measures for. Part of it also, though, is we need people's cooperation to be able to make sure some of the things I led off the top of the hour with, which is when you go to the store, keep your 6-foot distance, right? Don't go unless you really need to go shopping. Make sure that when you're in public places, you're outdoors even, you're still keeping that 6-foot distance and don't congregate in groups of people more than 10. Those are the things we absolutely need to have help with. I know that this weekend, for example, I think we had a birthday party of 30 people in Lincoln, and the local police had to go tell them they had to get the size of that party down. Yes, local law enforcement will be making stops to go out to tell people that you have to get it to 10 people or less, or if you've got a business that's not supposed to be open or whatever. So right now, we don't need to have more restrictions. What we need is for people to help us comply with the restrictions we have in place.
We just have about one more question.
One more question.
We have one more question.
All right, you're up. You got it.
It was, I believe it was a mother who was wondering that if schools do eventually come back into session this year, would individual parents be allowed to keep their children at home? And if they're not allowed, would they be penalized in any sort?
Sure. So the question was, if schools do come back this school year, will parents be allowed to keep their children at home? First of all, I think that when we had the press conference on Friday, Commissioner Bloomstead was pretty clear that schools are not going to be coming back in session this school year. And obviously, we have to see how this all works out over the course of the summer for the fall, beginning the next school year. And with regard to parents and their kids, look, parents are ultimately responsible for the education of their kids. They need to work that out with their local school district. Maybe they want to consider a homeschool options. There's other options out there, but I would say, hey, parents, if you have questions about this, the first person I talk to is go to your principal of your school and talk to them about what their plans are, what they're thinking about this. As we've looked at all these different issues, one of the things we found is communication is key. If you bring up a question, sometimes it's something nobody thought of, and they're willing to work with you on that. Sometimes they just need an issue raised in awareness, and they'll work on it. So I would say for the parents out there who are concerned about this, again, my understanding is this school year, schools will not be operating with children in them. Teachers are still going to be working to help kids get educated throughout the balance of this year and get them ready to advance and grade for next year. But if you're worried, if this continues to next year and that's what you're worried about, work with your local school district. I'm sure they'll be very accommodative. Again, folks, thank you very much. I appreciate you all taking the time this afternoon for our regular weekday update. We will continue to do that the rest of this week, have these weekday updates, and so we'll see you back here again tomorrow at 2 p.m. Have a great day. Commissioner. Thanks, RJ.